So here I'm using the anterior Nebraska 128 sickle. I use a light grasp when holding the instrument, but make it more firm when I feel a piece of calculus and I apply more pressure. To make sure that I'm adapted to the tooth, I make sure that the instrument is parallel to the tooth surface, holding an angulation of 70 to 80 degrees. My fulcrum is 1 to 3 teeth away, and how I use the instrument is I start at the mid-facial and work my way to the edge of the tooth using 2 to 3 millimeter strokes. For surfaces towards, I sit in an 8 o'clock position, making sure my wrist is neutral. The rationale for the anterior sickle is to be used on the anterior teeth and works supragingival because it has a pointed toe. For tooth number 14, I'm going to be using the 15-16 for buccal and mesial surfaces and the 13-14 for distal surfaces. I determine the correct working end by placing the end between two posterior teeth and seeing if the shank goes up and over. You're using the wrong end of the shank if it crosses a tooth. My grasp is light, using exploratory strokes until I find a ledge of calculus and then apply more pressure and use horizontal and oblique strokes to remove the calculus. I use short 2 to 3 millimeter horizontal and oblique strokes on the buccal surface and then roll the instrument interproximally doing vertical strokes once I get to the mesial. I use vertical strokes on distal when using the 13-14. You want to make sure you're inserting the curette under the gums. The rationale of using the 13-14 and 15-16 curette is to remove any subgingival or supragingival calculus. For surfaces away, I sit at a 12 to 1 o'clock position, and for surfaces towards, I sit at 8 to 9 o'clock position.